Hey everyone, welcome to our video. We are a group of students from Normal Community High School and members of our HOSA chapter who are passionate about making a positive impact on our community's health. So today we are going to be talking about epilepsy.
We'll be posting a link to the survey in the description below so you can take it to see what you already know about epilepsy. Today in this presentation, we'll be talking about what epilepsy is, the different types of it, what causes it, and what symptoms there are. At the end, we'll talk about treatment options and how to help patients with epilepsy. So, what is epilepsy? It is a neurological disorder affecting the brain and causes recurrent unprovoked seizures. Epilepsy can affect people in many different ways. There are many causes and many different types of seizures. Along with epilepsy, people can develop other medical conditions. These factors play a major role in determining both the severity of the person's conditions and the impact it has on their lives. These are a few statistics that we found on epilepsy. There are currently 3.4 million people with epilepsy nationwide, that consisting of 3 million adults and 470,000 children. Each year, about 150,000 Americans are diagnosed with epilepsy, and over a lifetime, 1 in 26 U.S. citizens will be diagnosed with the disease. These are a few common myths that people have when it comes to epilepsy, including that it is a life sentence or it is a mental illness, and we'll be talking about in the slides upcoming.
What isn't epilepsy? Epilepsy isn't provoked seizures. These seizures can actually come from other stuff like physical causes, acute medical illnesses, and other substances or events that the body is responding to or withdrawing from, such as drugs. These factors affect the brain, which leads to provoked seizures, which are not related.
Different types of epilepsy. There are mainly two types of epilepsy, generalized epilepsy and focal epilepsy. In generalized epilepsy, seizures affect both part of their brains, causing widespread of the discharges. And focal epilepsy is when seizure starts in one area of the brain with localized effects. Some individuals may experience both generalized and focal epilepsy. It is unknown to determine if the person has generalized or focal epilepsy. In some cases, the specific classification may be challenged due to the various factors. What causes epilepsy?
There are three main factors of epilepsy, which are age, genetics, and brain injuries. First, epilepsy can affect anyone in any age group, but depending on your age, the likeliness of getting epilepsy varies. Usually, younger children or older adults are at higher risk. Second, there is a significant genetic component to epilepsy. If someone in your family has it, you may also be at a higher risk. And finally, head injuries, strokes, or other traumatic brain injuries can increase the likelihood of developing epilepsy as well.
Next, common symptoms of epilepsy are sudden falls, uncontrollable jerking movements, confusion, anxiety, weakness, and staring. However, a symptom of epilepsy may resemble other problems or medical conditions, so always consult your doctor for a diagnosis.
Treatment options for epilepsy.
There are four main treatment options when it comes to epilepsy, including medications, surgery, devices, and dietary therapies. Anti-seizure medications are proven the most common approach to treating epilepsy, and they are the most helpful. Surgery is generally recommended only for focal seizures in people with drug-resistant epilepsy or if they have an identifiable operable brain lesion. There are devices to help epilepsy such as neurostimulation devices called VNS therapy. They are among the non-drug therapies that use innovative technologies to send targeted stimulations. Epilepsy can also be treated with dietary therapies, including ketogenic modified Atkins and other approaches to control seizures. Is epilepsy curable? This is a question asked by many. Epilepsy is not necessarily a lifelong condition. While there is currently no medical cure for it, people that have been diagnosed with it as children are said to outgrow it after a certain age. If people haven't had seizures in more than 10 years, and if those 10 years consist of you not taking epilepsy medication for the last 5 years, that means you are said to outgrow the disease.
After learning so much about what epilepsy is, how can we help? It is very important to equip ourselves with knowledge on first aid procedures so we know how to respond under an emergency. We have the seizure first aid 3 S's. First, stay. Stay with the person, Remain calm and start timing the seizure. Next, save. Move away any harmful objects to keep the person safe and avoid any other injuries. Side. Turn the person to their resting position if they're not awake and aware. And then we have the seizure first aid 3 don'ts. Do not block airway. Put something soft and small object under their head. Loosen tight clothes around the neck. Do not restrain. Do not put anything in their mouth. Don't give any water, pills, or food until the person is awake. Finally, this is our Instagram and Facebook account. We post daily facts about epilepsy, so please follow us for more information. Thanks for watching.